Hi, everyone. I'm the director for New Zealand's not-for-profit charitable trust called Common Knowledge, and our trust has been set up in New Zealand since 1996. I brought 25 years of skills into New Zealand, and those skills were what I and hundreds of mothers and fathers, just like you, developed in the early 1970s for childbirth preparation, how to prepare our body for birth, and skills so that we could cope and manage and work through the activity of birthing our baby. And today I'm going to talk to you about what I've learned in the 50 years I've been involved in birth, which is what is this thing called childbirth interventions? And in the description, I have a long blurb, and on the screen, I have interventions and what an ideal birth is considered to be, and I'll put the JPEGs onto the post as well. So when I gave birth in 1970, in the United States, we just all went to the hospital and had all these assessments and monitoring procedures. Didn't like them all. And you don't have the same ones we did. You're no longer shaved. You're no longer given an enema. You don't have to lie flat on your back. All sorts of things have changed. Also during that time, which is curious, there was the first childbirth preparation classes ever taught, which was Lamaze and Bradley. So that meant from the 60s to the mid-70s, multiple millions of mothers and fathers actually went into the hospital and used some level of skills to birth their baby, to cope and manage better with a natural occurring pain, even though we had all these fiddly things done to us. But when I gave birth in 1982, things had changed. First of all, the evidence-based practice had changed in the day. The natural birth movement had become very global and had become very, very vocal. And so this question of what happened to us when we went into the hospital or when we had home births or went into birth centers really came into the foreground. And what was interesting to me was that the medical assessments, monitoring procedures got all lumped into one word called interventions. And they were implied now to mean that they were unnecessary, uncalled for, and imposed on women. So many years ago in New Zealand, I and a midwife taught strengthening the partnership workshops. And because New Zealand in 1990 put in a midwifery model of care, everything everybody wanted is put into New Zealand. There's a partnership model. Women's choices are respected. Midwives are direct entry. Women love their midwives. They care for everybody. The midwives can work in the hospital and have their own clients, or work in community and go into the hospital if there needs to be. In fact, they stay the lead maternity care even if they need obstetrical care. And it's free. It's everything everybody wanted. Everything. And it's an amazing system. So what I'm about to say, do not confuse that with this amazing system. Midwives have a strong ideology that supports the natural birth movement, that believes that pregnancy and childbirth are normal life events that rarely require medical care. And the cesarean rate was 12.9% when midwives became the lead maternity carers in New Zealand. And it's about 26 or 27% now, or perhaps higher. So in fact, midwifery care, partnership model, direct entry midwifery, free to the consumers, respecting women's choices, does not produce whatever this belief is that pregnancy and childbirth are normal life events, because nobody's really defined the word normal or natural or even physiological. The implication is that those are easy, healthy, good outcome things, whereas you can have lots of problems. They're still normal, natural, and physiological. So when we taught the strengthening the partnership workshop, what we were trying to say, what our trust was trying to say to New Zealand midwives, and we're saying this to all of you birth providers now, is to have a strong partnership. You need to want your clients to self-learn birth and birth coaching skills, and then use those skills to work through their baby's birth journey. Because giving birth, and the word giving is such a weak word, it is an activity that each woman does with her baby, no matter where she births, no matter who's present, no matter her circumstances, her beliefs, her choices, her lack of choices, the change of choices, or what happens to or around her. Every woman has to do the activity of birthing her baby. Now, in the description, you'll be able to read what some of my thoughts are about it, but I really want you to understand that the first question that I ask the midwives in the Strengthening the Partnership workshop is, what are your goals? As midwives, what are your goals? Well, of course, everybody says a safe, healthy mother and baby. I mean, that goes without saying. No birth professional wants something other than that. So that's a given. Everybody is working toward that. And families are working toward that. And the question is, how do you work toward that? And that's where assessments, monitoring procedures came into it, because the medical profession, yes, the medical profession, believes that if you do assessments, monitoring, and procedures, that you can pick up things, or you can deal with things, or you can solve problems. This isn't a bad idea. It's just, it is what it is, what it is, what it is. The midwifery model, or the natural birth movement, has a belief that birth and pregnancy are safe until proven otherwise. However, unless you've lived under a rock, every birth professional has some sort of training. And in New Zealand midwives who promote the concept that pregnancy and childbirth are normal life events go to school for 4 years. Well, why do they go to school for 4 years if this is such a nothing burger? It's just a normal life event. You just leave it alone and she'll be right. Well, they go to school for 4 years just in case, which means that they learn how to do assessments, monitoring, and procedures, right? And they want more natural births. And so when you ask them, what do you want? More natural births. Then you ask them, what's preventing that? What is preventing or millions and millions and millions of women around the world from having a natural birth? Because a cesarean is a surgical birth, but your body's still preparing to birth and your hormones are. But let's just leave cesareans out for a moment out of the side. So let's assume women are laboring and having a vaginal birth. So it just goes along, good or bad, right or wrong, ugly, safe, tragic, whatever, culpable, suffering, whatever, goes along. We know that. So when you ask natural birth advocates, and many midwives are natural birth advocates who believe that pregnancy and childbirth are normal life events that rarely require medical care, they believe that the reason more women aren't achieving this natural, spontaneous, instinctive birth is due to interventions. So we made a list, and here's the list. The belief that if a woman has a vaginal exam, that prevents her from having a natural birth, or artificial rupture of membranes, or doctors are not following the woman's birth plan, or that the woman is afraid, or an induction of labor, or IV fluids, or pharmaceuticals, or handling, or over-touching, or directing women, or cesareans, episiotomies, a lack of the ability for women to move, hospitals, cervical sweeps, forceps, ventouse, beds, scalp monitors, manipulating positions, ultrasounds, not being able to eat or drink, not respecting the women's choices, any standards of care, telling the women to push, limiting the time of first stage, limiting the time of second stage, tugging on the cord for the placenta delivery, not trusting the woman's instinct, not having the ability to birth in water, or pain relief. Goodness, that's 30 things. So me as a woman, or you as a woman, because I'm not going to have any more kids, I have to avoid 30 things in order to achieve what midwives would like me to achieve, a natural birth. That's a lot. That's asking a lot. And that builds the shame, blame, guilt, disappointment, anger, frustration that we see in women today and have since the 80s, because this is what got developed in the 1980s. This belief that assessments, monitoring, procedures were interventions, and interventions were imposed on women and they were unnecessary. And all you had to do was say no to them, and say no to them in your birth plan, or say no to them at the time of birth. So then I asked the midwives in the classes, What is your ideal birth? So we have to know what we're aiming for. So if we have to avoid those 30 things, what is it we're actually trying to achieve when we use the word natural birth or normal birth or physiological birth? So here's the list. So an ideal birth is hands-off, it's undisturbed, it's instinctive, there's no interventions, it's spontaneous, women are in control, no pharmaceuticals, a woman is active, it's biologically led, it follows the body cues, it's spontaneous onset of labor, no drugs, no rupture of membranes. The Ferguson reflex or spontaneous pushing. Women are listening to their bodies instead of outside voices, allowing time for birth to progress, a physiological first, second, and third stage, a protection of the birth territory. Women in the peak of health experience love during the experience. Once again, spontaneous onset of labor. Whatever is normal for that woman, a vaginal birth with no assistance, follow a woman's birth plan, and a physiological third stage. So that's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, approximately 23 things to have an ideal birth. Now, I just want to ask you, woman to woman, how are we doing with each other? Now, I'm going to sound like a cranky old lady, and after 50 years in the childbirth conversation, probably I am, which means that I should probably have all of these YouTube videos called The Cranky Old Lady Talking About Childbirth. But what are we doing to each other as women? And that's a question you need to ask yourself, and you need to talk to your women friends about, and to your women birth professionals. What are we doing? We are making it so bloody hard for any of us to achieve an empowered birth experience. I talked to the mother, she's my age, I'm 76, so this is how deep this goes. The mother of her son was the head of an agency in New Zealand, so he was my kids' age in their 40s. Okay, she was my age, in her 70s. And she said to me, I wanted a natural birth, but I was induced. That means all of her life, she has felt she didn't achieve something. That's what we're doing to each other as women. That's not what our trust has done. That's not what all the families in Birthing Better have done. We took a different path in the early 1970s. We knew we were going to have assessments, monitoring procedures. And by the 80s, we knew that they were being called interventions. And you know how we dealt with it? It was simple. We developed skills. There were already skills, Lamaze and Bradley, but they weren't great. It was the beginning. So we can expect them not to be filled out. Birthing Better skills, fathers and mothers developed. So boy, did we fill them out. There's a whole range of skills, whether it's breathing or preparing your body, or your bony structure, or your soft tissue, or teamwork skills, or how to communicate verbally and non-verbally during birth, or what happens when you have negative thoughts and get on with it. We have so many skills. People go, oh my God. And we go, it is an activity. It's a one-off. It can't be repeated. It's infrequent. It's life-transforming. It's dynamic, and it's important. So we are treating this activity as though it's something we can plan like a wedding, and that we require those people around us to give us the birth we want. But babies don't come to plan, and you don't know what your birth is going to be like. So we chose to become skilled. Why did we become skilled? Because shit happens. Because we are going to have assessments, monitoring procedures, unless we birth by ourselves. And boy, you want to be skilled for that. Honestly. So if we want an empowered birth, we have to stop focusing on what happens to us around us. And we have to focus on our ability to work through the activity of birthing our baby. No matter where we birth, no matter who's present, no matter our circumstances or our beliefs, or our choices, or lack of choices, or the change of choices, or what happens to or around us. We can't control that. We can control us. We can birth with dignity. Now, if we are wired for sound, We have tubes and wires coming out of every single one of our holes. If we hate every single minute of it, when we are skilled, we can cope, we can manage, we can work through the activity, we can handle things, we can deal with things, we can stay on top of things, and we can feel in control because we use skills to work through the activity. And where do we know this in the rest of our life? In anything in the rest of our life. My goodness, if you're a parent, you have to be skilled. You don't have to like your kid that day. You don't have to like the situation. With COVID now, the more skilled we are to just cope with being shut in or shut out, the better we do. We can't control factors. The medical profession, the midwifery profession are going to do assessments, monitoring, procedures because that's their standard of care. Evidence-based practice may change, but it's their standard of care. And if you don't want any standard of care, definitely many Birthing Better families birthed at home alone. That was their choice. And trust me, they became skilled. It's like learning CPR. You become skilled. The Heimlich maneuver, you become skilled. Skills to drive your car safely, you become skilled. My goodness. Skills to be a good lover, you become skilled. Skills to know how to cook when you're hungry rather than just stuffing your face, you become skilled. Giving birth as an activity, become skilled. So if you're going to have assessments, monitoring procedures, which you will have, and you may not like them, and if you have those things called intervention, which you feel are imposed on you, that may be true. Right? Become skilled. Okay, now this cranky old lady has said her piece. Please pass this on. Please comment. Please tell us what you want our trust to talk about. And please just choose some skills-based method. Tell your birth provider which one. And then have them mark in your notes from 24 weeks, at 28 weeks, 32 weeks, 36 weeks, 38, however you see them. Put down, have them mark in your notes what skills you've learned. Those are in your notes, which means that at your birth, no matter what's happening to you, if you are coping and managing well, tell them, we want to be praised. Darn it, tell us, we're doing well. We need to know that. And if we look like we're uncomfortable or overwhelmed or freaked, look at our notes. See that we learned some skills and encourage us to use them. Because here's the reality. You got pregnant to have a baby, not a type of birth. That's it. You got pregnant to have a baby. And the activity of birthing your baby is how you get your baby out of your body, one way or another. And if you do that with skills, you will look back on your birth and you will be very empowered. We know because we've been around for 50 years, which means tens of thousands of families have used our skills-based method. And we know how empowered people were with Lamaze or Bradley or hypnobirthing or hypnobabies or calm birth or birthing within. Whatever you use skills. Okay, see you guys later. Talk about something else another time.